Greetings. This is Justin Allen with the Elite Nurse Practitioner. This is the Bioidentical Hormone Pellet Course. This is the Elite Nurse Practitioner guide on how to successfully integrate pellet therapy into your practice. Pellets are one delivery method for hormone replacement therapy. They should not be the only delivery method that you have, but pellets are in demand. Patients like pellets, especially women. So I believe it is very important that you have this service in your practice if you are offering hormone replacement therapy, because some patients will just want pellets, and pellets work great for some patients, okay? So it's very, very important that if you're offering hormone replacement therapy or if you have a wellness practice that you have this as an offering. It'll increase your practice's revenue and it'll increase your patient satisfaction. Now, the authors. I am Justin Allen. I am a family nurse practitioner. I am owner-operator of the Elite Nurse Practitioner. I own 2 men's health practices, and I also own a medical cannabis clinic. My men's health practices went from $0 to $70,000 a month in revenue in just 2.5 years. We provide hormone replacement therapy, IV infusion services, weight loss services, but my practice predominantly does testosterone replacement therapy, and pellets are just one of the delivery methods for testosterone. And this is Heather Quaile. She is a DNP. She is owner, founder, and CEO of the Show Center. This is a sexual hormone optimization wellness clinic that she owns and operates. She is also the lead nurse practitioner at the Wellspring Living Receiving Hope Center. She leads the medical program for sexually trafficked teenagers there, and she's also an adjunct faculty member at Vanderbilt University. So she is very busy, and she has her fingers dipped in multiple different things. She will be going over a lot of the pellet basics and also the women's component of hormone replacement therapy, and I'll be covering the men's health testosterone replacement therapy component of this course. So why should you integrate bioidentical hormone replacement therapy pellets into your practice? Multiple reasons. The bioidentical hormone replacement therapy market is estimated to be $10 billion market. Okay, $10 billion. It's a lot of money. Okay, there's a lot of demand for this. It is predicted to grow 6% year after year, especially as the population gets older and older. So what does this mean? It means a huge business opportunity for the astute nurse practitioner entrepreneur. People are willing to spend cash on these services. That's why it is great. It is a cash business. You don't have to deal with insurance. There is a very large and diverse target market with this. Any age, any sex or gender identity, all economic classes. This can be started as a standalone practice or integrated into any type of primary care or wellness practice. I personally believe it should be integrated with many other forms of hormone replacement therapy, okay? Every provider, every patient is going to have different preferences, all right? You can do this as a standalone practice, just offer hormone replacement therapy pellets, and that is it. But I'm telling you, if you want to hit every demographic and every preference, you want to deliver pellets in addition to injections, creams, and those sorts of things, okay? This should predominantly be a cash business, but could be integrated with insurance. It is generally a low overhead practice and has a low barrier to entry. Very little equipment or supplies are necessary for this. It is very easy to learn. If you can start an IV, you can insert a pellet, guys. It is really not that hard. Putting a pellet in is super simple. It's nothing to it. Treatment is pretty straightforward. It's generally a low liability practice and it has simple follow-up. You're really only following up these patients to put more pellets in and to check labs. It's very, very easy. And as always, it is very rewarding, okay? You're going to love seeing your patient's health improve in every aspect. You're going to love seeing them come into your office and they are going to look better. They're going to feel better. They are going to have just a different glow to them, all right? It is awesome and it is super rewarding. So this is why you should be integrating pellets into your practice. If you have a wellness practice or you're offering hormone replacement therapy already, you should integrate pellets into it because there is a demand for it and it is just one of many delivery methods for hormone replacement therapy. So what are bioidentical hormone pellets? So bioidentical hormone replacement therapy, you are providing exogenous hormones that are identical to the hormones the body naturally produces, okay? So you're just giving outside hormones that are bioidentical into the body. So BHRT pellets, they're small pellets that are inserted into the subcutaneous tissue that have varying amounts of bioidentical hormone that is slowly released over a period of time, generally between 2 to 6 months is typically how long they last, right? So they just slowly release the hormone over time. So who can implement BHRT pellets into their practice? Any nurse practitioner has it within their scope to administer bioidentical hormone replacement therapy. Acute care could be questionable, right? There's not really an acute need to have hormone replacement therapy, but providing hormone replacement therapy is within the scope for everyone from family nurse practitioner to psych. You can even offer this as psych. If you are prescribing it for a mental health issue, anxiety, depression, low motivation, then it is within your scope. Hormone replacement therapy improves anxiety, improves depression, improves insomnia, improves motivation, okay? There is a mental health aspect to it as well. It makes for a great service line for established practice owners or as a standalone practice. It is cheap to get started. $1,000 to $2,000 to implement it into an established practice. That is it. That's basically just the cost of supplies in this course, all right? It's really not expensive to implement this into an established practice. If you want to start a standalone hormone replacement therapy clinic, you're looking at about $5,000 on the cheap end, okay? I started my men's health practice for $5,000. I started the second men's health practice for about $7,500. It does not cost that much money to start these practices, folks. It really doesn't. Low overhead, low expenses. The cost of the pellets and the equipment is relatively affordable in the grand scheme of business. Typical overhead of a small practice that offers bioidentical hormone replacement therapy and pellets, you're looking at between $1,000 to $3,000 a month. It's really not that expensive to keep a business like this up and running. And it also has solid margins, okay? You're looking at between $300 to $700 profits per insertion. That's going to depend on how often you're inserting it, what the prices of pellets are going for in your area, how many pellets you're putting in, all kinds of different things, okay? So the margins are good. This is a very profitable business to start. Now, I'm going to let you know though, if you go with a different company that trains you how to do pellets and you must use their pellets only, your margins are going to be cut by 50%. Those companies take 50% of your profits, okay? That's why we came out with this course to teach you how to do it so you're not giving these sharks money. You can do this yourself and keep the profits yourself. Is providing hormone replacement therapy within the scope of the nurse practitioner? Absolutely. I already covered this, all right? Providing BHRT falls within the scope of most NPs, including psych. Mood improves with hormone replacement therapy. Now, regulations. Most states do not have any specific regulations surrounding the administration of bioidentical hormone replacement therapy, okay? Most states just don't. The main regulation you need to be aware of is storing and dispensing controlled substances in your practice. And this is going to be predominantly testosterone pellets. You maintain logs in which patient received it. Now, liabilities. Hormone replacement therapy in general is a low liability practice, okay? Practice safely. Remember, choose your battles wisely. Generally speaking, most of these patients will be fairly healthy, okay? So just practice safely and don't worry about it. All right, course topics. We're going to go over the introduction to pellets and bioidentical hormone replacement therapy. We're going to go over the growing demand of it. We're going to go over laboratory interpretation, pellet dosing protocols, the consultation process itself, how to actually do the procedure, okay? We included videos with this. It's very simple, guys. If you can start an IV, you can insert a pellet. It's really nothing to it. We're going to go over frequently asked questions that patients will have. I'm going to go over all the practice creation and management components. And we're also going to go over supply ordering and much more. So I hope you guys enjoy this course. Heather is going to go over the next section in terms of the hormone replacement therapy and just the basics of pellets. I'm going to circle back around and go over the testosterone men's health component. And then Heather will go over the procedure, the women's section, and everything else with pellets. And then I'll circle back around at the very end to go over all the business stuff. And I hope everyone enjoys the course.